21% of all reported HIV cases occur in LGBT youth aged 13 to 24. It is no coincidence that inclusive sex education for LGBT youth is scarce, and the rate for LGBT HIV and AIDS is higher. It is necessary to have an inclusive sex education program implemented in the U.S. to protect the wellness of the LGBT community. 8 states ban any conversation on queer relationships in a classroom setting, and 4 states outright require sexual education classes to be taught in a negative light. In these states, important knowledge and interventions are being deprived from LGBT youth. Although some of these sex education programs claim to include the LGBT youth, many are demonizing, excluding, or try to ignore LGBT youth altogether. Only 4% of LGBT youth in the U.S. claim to have been taught positive information about LGBT issues.
My experience with sex ed was very difficult. There was always the, how does gay sex work? If there are two lesbians, who's the woman, who's the man? Questions like that were never sort of like, how can LGBTQ people be included? I can remember being younger and like having sexual feelings and thinking that I was like wrong or disgusting. I didn't feel safe enough to come out until I found somebody that I actually wanted to date. So a short while after we came out, me and my partner were called into our school's counselor office, and we were threatened with suspension if we continued to sort of like hold hands and show PDA and things like that in the hall. Now,
Educating the youth on sexual education of all genders and sexualities can be potentially life-saving. Preventing deadly STDs such as HIV and AIDS from occurring in the LGBT community by educating LGBT youth about safe sexual practices will lower the overall occurrences of HIV and AIDS. The more men that know condoms are still necessary even without risk of pregnancy, and the more women that know about dental dams, the safer the community will be.
There are huge health consequences for not having proper sex education. Queer people are not getting the proper education on how to protect themselves from HIV and AIDS. And not just HIV and AIDS, we have a serious problem with gonorrhea right now in the gay community.
Although many parents may argue against inclusive sex education by saying it will turn their child gay, and that school is supposed to be for education, not indoctrination, according to a survey done by the Human Rights Campaign, 85% of parents support the discussion regarding LGBT sexual health in classrooms. Sex education's purpose is usually said to be set in place to prevent teen pregnancy and to promote the sexual health of teens in the U.S. Educating youth on safe sex is not only for heterosexual intercourse, but for LGBT intercourse as well, will hopefully cut down on deadly and harmful STDs.
Being isolated is a very universal experience in the gay community, and for a lot of people, it's in the sex education classroom.
sex should be normal for everybody, and it's okay to talk about it.
We're only being taught that a vagina and a penis is the only way to have sex.
If sex ed were more comprehensive, then it would shape a lot of the policies that we had.
We need protection. Trans women of color are being murdered at an alarming rate.
Sex education is not just for straight cisgender people. With such an up-and-coming LGBT community, students need to be taught more about how to treat, address, and handle LGBT issues. For example, only 1/3 of gay men report using condoms. Latex condoms prevent the spread of deadly STDs such as HIV and AIDS. Most men report not using condoms because they feel that they are not needed. The risk of conceiving a child is absent. However, the risk of contracting an STD is still present. Too many LGBT youth are sitting in classrooms and school environments that fail to acknowledge their sexualities or identities. Inclusive sex ed in the U.S. is needed in order to keep a large community of students safe and to help non-members of the LGBT community coexist with others.